Good afternoon, Dr. Sin. Would it be all right if I present a patient that I just saw? I've completed a history, a physical, and I have a provisional and differential diagnosis and a plan as well. Okay, I'd like to present Miss Wells. She's a 28-year-old female. She has a history of asthma and is coming in after a recent asthma exacerbation. She reports that 2 days ago she had a near asthma attack after being exposed to cats with significant wheezing and shortness of breath that was only partially improved with her albuterol inhaler. Since then, she's been having symptoms about every 4 hours, along with nighttime awakenings twice per night and a dry cough. She also mentioned that she feels that her inhaler hasn't been working as well as it used to. As far as her history, it's notable for multiple hospitalizations for asthma in childhood, but none since the age of 16, and she has had no prior intubations, but also currently does not follow with a specialist like a pulmonologist or an allergist. She also denies any environmental exposure to triggers. On exam today, she's stable. Her oxygen saturation is 97%. But she does on auscultation have bilateral expiratory wheezes, and her spirometry showed a normal FEV1 FVC ratio. Overall, this sounds like it's most consistent with a moderate persistent asthma, and it's currently not well controlled. However, some differential potential diagnosis would include GERD, especially since her symptoms have been worsening when she lies flat, or possibly vocal cord dysfunction, although due to her wheezing and her poor response to the albuterol inhaler, it makes asthma a more likely diagnosis. Would you like me to continue with the plan? My plan would include step-up therapy using the NAEPP guidelines, going to step 3, starting a low-dose inhaled corticosteroid along with a long-acting beta agonist. I would continue the albuterol inhaler as needed and review her inhaler technique with her. I also think providing an asthma action plan would be prudent and counseling her on avoiding triggers, especially cats, and having her follow up in 2 to 4 weeks to reassess for control. Thank you.